Welcome to Back to Basics, a podcast where we return to the wisdom that has been with us from the very beginning. In a culture that's drifting further from the truth, we're finding our footing again in faith, family, and the timeless ideals that lead to true physical, spiritual, and emotional health. Join us weekly as we explore candid conversations with leading health industry experts, thought leaders, and healers as we get back to the basic values that make for a healthier world. I'm Anna Montanaro, your host, and you're listening to Back to Basics. Hello, everyone, and welcome back to another episode of Back to Basics. This week, we have a friend of the pod and fan favorite on, Dr. Natalie Underberg. She is the best when it comes to all things PCOS, preconception prep, fertility. The last episode I did with her was, July. It was a long time ago, and we talked all about unexplained infertility and PCOS and a number of different things. So if you haven't listened to that episode, I will link it in the show notes. Go back and listen. It's a great one. But today we're going to do part 2. We're going to dive even deeper, and I am so excited to chat. So Natalie, welcome to the show.
Thank you. I'm so excited to be back. I think it's my favorite podcast I've ever done. So I'm like, let's do part 2. Absolutely.
Yeah, we have to. And honestly, I feel like there are so many women right now, I mean, always, but now more than ever, that are craving your message. And like, I get messages from people all the time, Natalie, being like, how do I get in with Natalie Underberg? Like, she's so booked. I'm like, well, there's a lot that we can do. She's going to be back on the pod to answer your questions. And I know that you're doing the pregnancy prep boot camp in January. So let's talk about that just straight out the gate so that women who want to do that can sign up.
Yeah, absolutely. So I have my program that I created 3 or 4 years ago. It's called the Pregnancy Prep Academy. Was the only course of that nature on the market at the time when I created it. ChatGPT was not a thing, all the things. And I always ran it live, and I would do groups of like 40 to 50 women, and we would get on live every week, and I would teach it live, and then we'd have a Q&A after each group. It's also available evergreen. Like if somebody just wants to jump in right away and watch it, they can. The biggest piece I feel like people loved is the live aspect though. So I'm opening the doors again for that on January 17th. People can join again, do it with me live and have me on live. And several of like my friends that are also doctors are actually going to be joining too. Like they're like, we want to learn. So people are all welcome to join. We are going to obviously be in a limited capacity because it's live. So I can't have like 200 people in it, but I go through my exact framework that I work with patients in that capacity. I go through the whole framework, the whole roadmap of preconception prep. Through my course, I talk about all the labs and all the testing I do, from gut testing to vaginal microbiome testing to everything. I talk all about that in my course. And then even things like how to prevent morning sickness and nausea and what to do if that happens. Like, here are all my tips and tricks. I mean, we even dive into like vaccines, how to pick a provider, you name it.
Incredible.
All the things I can't really talk about in depth online or on Instagram. I can do it in like an educational format. So yes, everyone's welcome to join. I would love to have you. And it is such a great program.
Okay, perfect. This is going to be coming out before then. So we'll put the link to join in the show notes. If it's still open, you guys, I mean, I'm going to be joining. It's going to be incredible. So, okay, I put up a question box on Instagram. Yeah. I got a bunch of questions for you. A lot about fertility in general, preconception prep. But I think the best place to start are, for the women that want to get pregnant in 2026, what are the switches that you would make immediately today, right now, without even giving it second thought?
Yeah, I think immediately is reducing environmental toxins in my direct environment. This is any personal fragrance I'm putting in or around my body. This is the foods that are coming directly into my body. This is chemicals I could be exposed to in my workplace. Stress is a huge one, which I talk about this quite a bit. And I feel like people just glaze over because they're like, well, I'm stressed. My life is stressful. It's like, no, your body is going to be incompatible with pregnancy if you are stressed and living in a fight, flight, or freeze state. So that has to be like your number one priority is assessing. And I just posted on Instagram today on my stories, assessing the stressors in your life. It could be marriage, friends, family, work. It could be the fact that you just jam pack your schedule so full that you never have a minute to rest. These are all, like someone asked me today, How do I get my cortisol down? And I'm thinking the fact that your
How long do you
adrenals,
have? Yeah.
yeah, well, and the fact that your adrenals are producing cortisol is wonderful. If you stop producing cortisol, you will die. So we
Hmm.
need cortisol. Cortisol is just listening to what your body is saying, which is I'm running from a bear. I am in this sympathetic overdrive and I'm pumping out cortisol because we're not sending our body safety signals. We're not sending our body signals of satiety because we're not getting enough protein. We're not eating enough. We're starving ourselves throughout the day. And so, I would say the biggest thing is start sending your body safety signals as soon as you can in
Mm.
2026. Like, get out of that, like, hustle, run around 24/7, say yes to every commitment mentality because it's just not conducive with trying to get pregnant. It's just not.
Yeah, I have thought about this a lot in my own life because I'm someone that like does really well with
Hmm.
having a jam-packed schedule,
Yeah.
doing all of the things, like you said, hustling, and I
Yeah.
like it and it makes me feel good. And
Yeah.
especially with working out, like it
Yeah.
has come down to, okay, is it going to be better for me to go drive to this workout, go to a
Yeah.
spin class early in the
Yeah.
morning, or should I sleep in and go for like a long walk in the sun? And
Yes.
my tendency is to go towards the spin class, but
Yes.
I have had this come to Jesus moment with myself of like, actually, the walk in the sun and the
Yes.
sleeping in is so much more conducive to what my personal goals are right now for getting
Yes.
pregnant in
I
2026.
literally did that this morning. I set a
Yeah.
7:15 alarm to go to the gym and I literally was like, nope, I'm going to sleep an extra 40 minutes and
Yep.
I'm going to take a slow morning, which you have a fantastic routine. I mean, I see your videos, like the fact that you
Thank you.
have a wind down routine at night. Most women are not doing that. Most women are rushing through their day, running home, slamming down dinner. They're not being intentional about it. And then they're like, staring at their phone until they fall asleep. And
Right.
you have a really great routine in that you take care of your nighttime routine. You have a ritual that you do every night before bed. You read your Bible, I'm sure. Like things
Yeah.
like that in your day, a lot of people aren't getting that. So you should give
Yeah.
yourself more credit because I
Well,
think
thank
that
you.
you're
I
more balanced than
appreciate
you think.
that.
Yeah, I think you are.
But I also am lucky that I have, I have such a flexible schedule, but I also
Hmm.
want to say, like, when I was in my early to like mid 20s, I was living in New York City. I was working a like
Wow.
9 to 6 p.m. job. I was going to
Wow.
happy hour after. I was working out. And
Yep.
like, I think you can still bring intentionality to your life and moments of
Hmm.
softness, even amongst all of that.
Totally. 100% you can. Because I mean, I'm running two companies
Yeah,
and
like you're busy.
yeah, I just don't, I mean, I don't do a lot outside of like work and home and rest and gym and things like that. Obviously, I have quality time with my friends, but I'm not saying yes to everything. And that's
Yeah.
okay. And I think when I was 25, I would have, and I would
Yeah.
have been like, absolutely, I'll be at every party, every event, everything, every dinner. And I've probably said no to more than I have yes in this last like season. And it
Yeah.
feels good. I'm
Oh,
okay
it
with
feels
that.
so good. I'm the same way. And this is going to maybe sound a little mean, but I'm like, if someone can't respect that, like, sorry, we're just not compatible for being
Yeah.
friends.
Yeah. A
Like,
hundred
I want you
percent.
to protect yourself as much as I do.
Yeah. 100%. Absolutely.
Okay. I want to talk a little bit about common lab patterns that you see in women that are
Hmm.
trying to conceive and haven't been successful yet. Um, I'm getting a lot of questions about low progesterone.
Ooh, yes. So am I every week in my Q&A
Yes.
box.
Yep.
Yeah. So low progesterone, once again, symptom of a deeper rooted issue. And the biggest lab patterns I'm seeing are issues that lead up to that. So the higher insulin levels, lower pregnenolone levels, meaning that your body is kind of shunting resources towards cortisol versus pregnenolone. Um, I'm seeing a lot of high inflammatory markers, which that's also a big switch you can make in 2026 is reducing inflammation and finding ways to do that. So reducing the processed foods, reducing the sugars, reducing the runs through Starbucks, things that are just causing that low level inflammation that builds and builds and builds to a bigger issue. So as an example, I have someone I was working with recently for preconception and all we did was we implemented a moderately strict anti-candida diet, which was just like really being cautious of like certain carbs and processed sugars and things like that. And she stopped running through Starbucks like 5 days a week, literally dropped 20 pounds like this, started feeling fantastic, going back to the gym again, doing all the things. And the biggest thing was like, her biggest inflammatory trigger was the run through Starbucks every morning.
Yeah.
And it seems so small. It really does. But I was like, how many pumps of sugar are you getting in your coffee? Like 4 to 5. That's a ton of sugar. It's more than you should have in a whole day. And so those little tiny exposures to sugar were causing low grade inflammation that was causing problems all throughout her cycle. Low progesterone, low estrogen, because it was putting her body into fight or flight because it was signaling cortisol because she was running through Starbucks before she even ate breakfast. And then it was just kind of this compounding effect, right? So her patterns were high glucose, high insulin, low progesterone. I was looking at her charts and her progesterone would just never climb. And then as soon as we kind of got that out of her routine, we got Candida under control. We worked on gut, like all we did was work on gut health, really. Her charts and her cycles look amazing now.
Yeah.
So for her, it was like finding the other underlying trigger, but that's one. Um, and then low vitamin D, that's a huge one I'm seeing because we go back to sunlight exposure and people are not getting any.
Right.
So if low vitamin D levels are correlated with lower pregnancy outcomes, more miscarriage outcomes, more severe postpartum depression, things like that. And so if you're going into pregnancy already depleted in vitamin D, you're not getting that natural sunlight every day, you're not getting sunlight on your skin and your eyes, that's going to be a bigger problem downstream too, to even the ovaries. So melatonin is the most potent antioxidant in the ovaries. If we're not getting sunlight on our eyeballs to signal our proper hormones, hunger hormones, satiety hormones, melatonin, our sleep-wake cycles, all of that throughout the day, at night, our body is so confused with this overwhelming amount of blue light that we get all day long that our brain doesn't secrete melatonin the way that it should, and our ovaries don't have the antioxidant support that they need. So in return, we're seeing low progesterone because low progesterone is really just a result of like poor follicle health or a weak corpus luteum. And we need melatonin for all of that. So it's kind of a weird, windy cycle. But when you start to like put the puzzle pieces together, you're like, oh, okay.
Yes.
So it's like after a vacation, have you noticed like if you're at the beach or you're outside a lot and you get a ton of natural sunlight the next cycle, have you ever noticed you have a really healthy ovulation? Have you ever tracked that?
When I tell you, I was just in Florida.
Yes.
First of all, who doesn't feel like the hottest person that the hottest version of themselves that they've ever been after they've been on a beach vacation? Like,
right.
You're like fun in the sun. It's just the best feeling ever.
Yeah.
And yes, I've had that experience and it is so real.
It's so real. And I notice this too, like when we go to warmer climates and we stay for a length of time, things like that, my cycles are just like clockwork. Yeah. They're amazing. And I'm prioritizing the sun and all the things. Women who live in the northern climates, like my patients that are higher up north, Ohio, Minnesota, Indiana, all the things, they struggle a lot more because they're not getting that stimulus. And it is really hard when you live in a gloomier climate. It is. You have to work really hard to get that stimulus on your eyeballs and be more cautious with blue light. So that is huge. But it also just goes to show how much we can actually do with light to impact our cycles and our cervical fluid and our hormones. So we don't need like a billion fancy things. We don't even need like a billion contraptions. We actually can just use the sun a ton.
I literally just talked about this in a solo episode that is airing before this, but because I think we overlook the circadian rhythm so much when it comes to our hormone health, fertility, and everything that comes downstream from that. And like, just as much as like getting the early morning sunlight in your eyes has been such a game changer for me. I want to ask 2 clarifying questions quickly though, because I don't want women to hear, oh, melatonin is super important to ovarian health and then go start taking melatonin.
Correct. We want to teach your brain to make its own melatonin. We don't want to be supplementing with every single deficiency. The body is very good at making and secreting its own melatonin. The second it doesn't, there's a problem that can be fixed by environment, right? So blue light immediately inhibits melatonin. So if you are looking at a screen with blue light after the sun goes down, you are inhibiting melatonin. Like no matter what, no ifs, ands, or buts about it, it's happening. Now, can you protect that? Like with the red light, like blue light blockers, of course. Yep. And we do that, right? Like we don't have any lights in our house really on at night at all that are not beeswax candles or incandescent lights. It's very rare because I'm so sensitive to light. I won't sleep. Like I won't sleep at all. And yes, and I know we've talked about this. So I think that's really huge. Like when we run a Dutch test, for instance, a Dutch test looks at your melatonin levels and it
Mm.
shows us your adrenal patterns and it shows us your cortisol and all the things. And when I see high cortisol patterns on a Dutch test, I immediately see low melatonin typically, unless they're taking it, of
Wow.
course. But you can see these high cortisol patterns and then almost always low progesterone, really high estrogen because they're not efficiently eliminating estrogen from circulation. And those patterns are so predictable to me. I can almost tell someone by looking at their test what their lifestyle looks like, what their day looks like, what they're not eating enough of, and things like that, which is so, so cool. So tests like that can be really fun and helpful. They're not like absolutely necessary for everyone,
Totally. Yeah.
but it's cool if you need to see like, hey, what's happening in my labs from my lifestyle.
Yeah, that makes complete sense. So, would you say that it's accurate to say that high cortisol, inhibits healthy progesterone production?
I think absolutely it can.
Yeah.
Yeah, absolutely. In several different mechanisms, but I think it can. It's not one clear mechanism and driver. There's several things like we talked about earlier. There's several different pathways that are
Mhm.
being affected by high cortisol.
Makes sense.
Hmm.
So what are some symptoms that women can look for in their cycle
Yeah.
that might tip them off to the fact that maybe their body isn't not officially, efficiently making
Yeah.
progesterone?
I think a big one is immediately after ovulation, if you start to feel irritable or if you start to feel anxious or you start to sleep really lightly, you're not getting that deep sleep anymore. A lot of women notice heightened PMS symptoms. So breast tenderness is a really big one because you don't have enough progesterone to oppose estrogen. So that's a really big one. Maybe they feel crampy. But I think the biggest ones that I see are irritability, anxiety, crampiness, and poor sleep quality. So almost always when we start to correct progesterone, people start to tell me one of the first things they tell me is my sleep is better. I
Mm.
don't feel as anxious. I'm not snapping at my husband as much and my boobs don't hurt.
I
And I'm
mean,
like,
yeah.
that's what we know. We fixed it.
What
But
about
the
short luteal phase?
short luteal phase, absolutely. Short luteal phase could also tell us that your corpus luteum is not as healthy and we're not making enough progesterone. So it could be that we did ovulate, we did make a little bit of progesterone, but we just quite couldn't get there. We couldn't make
Mm.
enough. I like to see like a nice, healthy 12-day luteal phase, ideally. 12,
Yeah.
13, even up to 14 is what I see in some of my own cycles. So I like to see those longer luteal phases. What I notice in a pattern of women, which you might even ask me this later, in a pattern of women who can't get pregnant, I'm seeing that day 7 to 8 post ovulatory drop off of progesterone.
Mm.
So I track this by having my patients use like a fertility tracker, like a Nido or something like
Yeah.
that. And I look at those charts and we see, okay, they've got a little bit of a progesterone surge and then it kind of died down. And that just means there's not enough progesterone to sustain implantation and
Mm.
to promote pregnancy. And I actually have changed my opinion on this since we last talked.
Okay, I'm excited to hear. I'm sure you knew what question I was going to ask next, so you go ahead and I'm curious.
Yes. I've been experimenting with this. I change my opinion on all the time on things, and I think it's a healthy thing to do. It means you're
Definitely.
open-minded. I have experimented with a few patients who have these exact patterns of giving progesterone like the last 5 or 6 days of the cycle, not the whole luteal phase. And
Mm.
it's resulted in pregnancy for quite a few. And
Wow.
so for people who are resistant to more, obviously the other things, so like B6 and vitamin C and things like that to raise progesterone, actually supplementing with a little bit of oral progesterone has gotten them to that positive
Wow.
pregnancy test. So yeah, I think our conversation has actually made what made me be like, okay, I need to like really think on this again and think harder and talk to a few more people about it and see if it's worth trying out.
So, okay, two follow-up questions.
Yep.
When you test that, I know that you're using a Nido, but if someone were to go get a blood test,
Yep.
7 DPO, where would you
Yep.
want to see that progesterone at? Like above
Yes.
20?
Above 20 is great. Above 15, if you're not pregnant, is also great. If you
Okay.
have a confirmed pregnancy test, which obviously you wouldn't at 7 days PO, but at 7 days PO, I like to see it above 15. By 12, 13, 14 days PO, I want to see it above 20.
Mm.
So I want
Okay,
to see
that's
it
really
climbing.
interesting.
That's why if I'm looking at an Anito chart, I can tell someone is almost always pregnant because their progesterone goes from like that nice, healthy, like 10, 12, 14, 15 range, and then it starts or topping out, I should say, at like 25, 30, 40. And it
Mm-hmm.
almost like goes off the charts and then it sustains that way. So if it's sustained that way beyond like 14 days PO, I can almost bet that somebody is pregnant by looking at their charts. And then I also see like little LH spikes later on
Yep.
in their cycle. And then I know,
Yeah.
okay. But yeah.
Isn't it interesting? I feel like, and I don't know what is environmentally causing this. I'm sure you have your opinions
Mhm.
and I have hypotheses. But Natalie, I feel like people having insufficient progesterone has become so much more common. And I don't know if it's just because I hear about it more often now
Mhm.
because my friends are trying to get pregnant or getting pregnant, et cetera. But
Mhm.
this feels like it's very common.
It does. It does feel really common. And I think you and I are in that world where we hear a lot
Yeah.
of these women saying that too. And I think I've just noticed it after 30, and it should not be this way, but in my
Yeah.
patients over 30, they're struggling with that more than ever. My patients under 30, not so much. My patients over 30, a little bit more, but I do feel like it's very heavily environmentally driven. I
Mm,
do. I
definitely.
absolutely think that our cycles and our hormones are different even now from 10 years ago. Something drastic has changed. The biggest thing, in my opinion, is technology exposure. I mean, even 10 years ago, we were not hooked to our phones like we are now.
Nope. I
I don't
agree.
think, I think that they've changed technology as well, too. I
Yeah.
think they've changed 5G. I think they've changed all of that. And my personal belief is that environmental triggers like EMFs stunt follicular growth. I
Yeah.
really think that they do. So for me, I'm like, what's worse now than like what is going on now that wasn't going on 10 to 15 years ago? And
Hmm.
it's the EMF exposure. EMFs are everywhere now. We're all hooked to electronic devices. Everything has gone digital, everything has gone virtual.
Yep.
And so I think, in my personal opinion, based off what I've seen and read, that is what I think is going on, is that it's heavily environmentally driven. And then obviously stress is a huge, huge piece of it too. And then obviously we talked about the light piece, but I believe it's a bigger issue than we've ever seen.
Yeah, I completely agree. So if someone is not at the point where they want to supplement with oral progesterone, or do
Yep.
you like topical progesterone or do you think it's BS?
I just don't see it working very well. I think if you just needed the tiniest, tiniest little bit of support, it works for
Yeah.
sure. As far as getting systemic and helping with implantation, I haven't seen it work that many times. But
Yeah.
I would say if you can't get an oral progesterone, topical is going to be better than nothing, 100%.
Okay, cool.
So,
That's good to know.
yes.
So for women who are like, okay, I want to check off all the holistic things that I can do to naturally increase my progesterone. Obviously,
Yep.
you mentioned being mindful of cortisol, thinking about
Yep.
screens and
Yep.
not exposing yourself to blue light after the
Mhm.
sun goes down. What are some other things, whether they're supplemental or
Mhm.
dietary, that you think could be helpful?
Yeah, one of my favorite things, and this is actually why I put it in my prenatal when we rebranded, is
Yeah.
acerola cherry. So vitamin C from acerola cherry is one of my favorite things. Not only does it help progesterone, but it also helps estrogen levels too. So for
Mm,
women with kind of like bottomed out estrogen and progesterone, vitamin C A has so many roles, but we need vitamin C for the corpus luteum. It's literally made of almost exclusively all vitamin C. And
wow.
so that's why we put it in my prenatal at a pretty hefty dose, which you can always take more if you want. But we have the 200 milligrams in the prenatal, and that has been enough to, like, within 2 weeks of starting it, I can see drastic changes in people's aneto charts. And they'll literally
Wow.
send me, they're like, this is before but your prenatal, this is after. And I wasn't seeing that before we put the acerola cherry in it. We had vitamin C, but it wasn't from acerola. And something about the whole food vitamin C really makes all the difference. So not only that, but I'm talking go and eat whole food vitamin C.
Hmm.
Load up on the kiwis, the oranges, the blueberries, the strawberries, like in your, I should say, before your ovulatory phase, in that follicular leading up to ovulatory phase of your cycle, load up on the vitamin C rich foods. And you will see that it will help with estrogen and progesterone later on in your cycle too, if you're really intentional about it. But
Very interesting.
yes, that and B6, vitamin B6 is great for progesterone production. If for the right person, Vitex can be very helpful. I don't like everyone to be on Vitex, but it can, if you really need the boost and nothing else has worked, you can try a little bit of Vitex and start
Mm,
low and slow and see if that helps. But I feel like Vitex over the last 7 or 8 years was like way overhyped, way overused. People just started using and abusing it and like
yeah.
putting everyone on Vitex. I'm like, okay, it's great for the right person. Not everyone needs it.
Right.
So those are a few things that I like to do, but acerola is like a huge one that I really, really love.
That is so interesting. I have
Yeah.
never heard of that in my life, and I'm sure I'm not the only
Yeah.
one. So that is such a hot tip.
Yeah.
Um,
There's a
okay.
great brand, by
Oh,
the
go ahead.
way, for acerola. If you're not
Hmm.
on my prenatal and you want to, or if you are and you want extra, I love the Perfect Supplements acerola.
Okay, we'll link that
Yep.
below.
Yep.
Amazing. Okay, so we've talked about progesterone, and obviously progesterone is super linked to
Mhm.
healthy ovulation.
Yep.
I got so many questions about what does healthy ovulation look like? How do we
Ooh.
know that we
Yeah.
had a healthy ovulatory part of our cycle and that we
Yeah.
A actually ovulated, but B
Yes.
that it was strong ovulation?
Great question. Okay. So this is going to start probably by about 9 or 10 of your cycle. You want to start looking for your fertile signs. So the goal is that we have like a really nice, healthy 5 to 6 day fertile window. And what this looks like is by maybe, let's say, if you're a woman who ovulates between, let's say, day 14 and 16 of her cycle, hypothetically speaking, about 5 or 6 days before that, you're going to start to notice some mild appearances of cervical fluid. It
Yep.
could be more for some women, but you want to notice some sort of cervical fluid presence in that 5 to 6 day window. Each day, we want to see it gradually getting heavier. By your peak fertile day, we want to see really nice, thick, or I should say more egg white like fertile cervical fluid. So it could be watery, it could be more egg white like, but we want to see a large amount of cervical fluid on that peak day for you. On
Yep.
that peak day, you should also notice a much healthier libido, more energy, more focus, more stamina. You might notice that you lift heavier at the gym. I mean, you're literally running on this like high of estrogen, which is wonderful, and I think women should take full advantage of it.
Yeah.
I I've told you like I like to plan my podcast around it. I like to
Yeah.
plan my business around it.
Yep.
Like we have a superpower, and that is ovulation, in my opinion. And
Yeah.
so that nice, healthy cervical fluid pattern in that 5 day window is really, really important. A healthy libido. You might also notice your lips are fuller. You might notice your breasts are fuller. That is a normal biological response because we want our partner to be like God planned this, right? Our
Right.
partner is more attracted. Like I don't even tell my husband I'm ovulating and he knows. Like
Yes.
he is more attracted, I think, to me on those days. Like it's just so funny how God has like wired us.
No, it's
Um,
literally this
yeah,
is the perfect example of God's perfect design. I said to my
yeah,
husband probably, I don't know, a few months ago, I was like, the
yeah,
secret that a lot of people don't know is
yeah,
that when a healthy woman is ovulating,
yeah.
she is hornier than a man has probably ever been in his entire life. And
Right.
like
Right.
that's by design. We are supposed to
Yeah.
feel that way
Right.
because that is when we are meant to procreate, right? It's when we're
Yes.
able to actually get pregnant. It is wild.
Yes, 100%. And women, I need to like this is a caveat, and I actually meant to say this when you asked me about like what to do if you're trying to conceive next year too. Women have this insane biological desire to get pregnant that men do
Yes.
not have. Like men
Yep.
have the desire to impregnate us, but they don't understand the biological desire that women have. Like once you decide you want babies, it's like on.
Yes.
And I feel like women get upset with their husbands because their husbands don't have that same desire but they don't have that maternal instinct like we have.
Right.
So I see a lot of women getting really angry and impatient with their husbands because their husbands are not like wanting it as badly as them or whatever it might be. And it's because that is not exactly how they're designed either. Like we have a maternal
Totally.
instinct and a maternal desire. We can't expect them to be women, but what we
Yep.
can hope for them to do is be vibrant and vital enough to make it happen. But you can't expect your
Absolutely.
husband to have the same exact maternal desire that you have. And I think women they're really stressing out over this a lot, I'm seeing. And so I'm like, I got to caveat that.
No, it's honestly needed because I even see this in the way that like I treat our friends' children versus the way my
Yeah.
husband does,
Yeah, of
where
course.
we will leave like a hangout with all of our friends and their toddlers. And I'm like, do you just love them? And
Yeah.
he's like, I mean, yeah, they're like cute and like I'll
Yeah.
play with them, but
Yeah.
it's not the same as when I have my little cub that I
Yeah.
will know is mine
Yeah.
genetically, and I
Yeah.
will have this paternal instinct to protect and provide for it
Yeah.
because that's how we are genetically wired. Whereas,
100%.
women, I'm like, I will treat your baby as my own.
Yeah. Well, it's just the same way, like when we are walking through like a parking lot, I am not looking for threats.
Right.
My husband has the license plate of every car memorized in the parking
Yes.
lot. He
Yes.
knows what man in every store has a gun on their hip. I mean,
Yep.
I'm not doing that. I am
Mm-hmm.
like, that shirt is cute. I love those
Yes.
shoes. And he is
Same.
like, where are the potential threats? And I'm sure your husband is the same exact
Yes.
way. And
Yeah.
so it's just so funny because God wired us that way. And so it's the same
Absolutely.
exact way when it comes to like preconception and pregnancy and getting pregnant and all the things and conceiving. And so it's just like, give your husbands a little grace there because I think sometimes they're not quite wired the same and that's okay too. But if you let yourself get stressed out over it, it will make it harder to get pregnant. So that's my caveat.
Yeah. When it comes to the stress thing, like, how do you think about, because for someone who is trying to get pregnant,
Mm-hmm.
this is a lot,
Yeah.
right? Like,
Yeah.
it's a lot that we have to think about, and
Mm-hmm.
it's inherently stressful to overhaul your lifestyle and be thinking
Yeah.
about these things,
Yeah.
8, 9, 10, 12 months in advance of getting pregnant. How
Mm-hmm.
do you make the distinction between stress in our lives that we need
Mm-hmm.
to work on to sort of
Mm-hmm.
bring that cortisol down to a healthy place
Yeah.
versus motivation that propels us forward?
Yes. I think this is a huge thing that I teach inside my pregnancy prep academy and with my patients. If you make this preconception phase of your life, this hyper controlled, hyper stressed, hyper planning state versus a pro informed state, you are going to be beyond miserable and stressed. And it will impact your marriage. It will impact all the things. And I think we've all been through phases. Like I've had months where I am like that. And then I have to like check myself and be like, okay, no, what we have to do is take in information, be able to apply it to our lives and not hyper fixate on it. And
Mm-hmm.
remember that we are not in control of the outcome. We are not in control of the timeline. And for me, that has been the biggest helper is just realizing like, in hindsight, sure, I would have loved to have had kids at 26, but like that would never have worked with our lifestyle and all the things too. And so it's like, I need to be leaning into understanding that God's plan is way better than ours could ever be. And the timeline has to be what He wants, not what we want. And so once you realize I can do my due diligence and learn everything I possibly can, I can make this a lifestyle. I can implement it into my life and I can do my best to continue living this way. You're going to have so much less stress. But also, when you look at these things like a long term lifestyle solution instead of like a 9 to 12 month like grind, it's so
Right.
much more sustainable. And
Mm-hmm.
also, it's just chipping away at making good decisions every day and feeling like, okay, I made empowered decisions today. I made informed decisions today. I don't
Mm-hmm.
need to be stressed out because I did the best I possibly could.
Yeah. And I think like when you distill it down to that, and also thinking about the fact that, and this is something that I have had to really put in front of me and be like, okay, this is the way that I'm going to think about this, is like,
Yeah.
this is a time where I get to enjoy delicious, healthy foods, where I
Right.
get to move my body in a way that feels
Yeah.
intuitive, not from a hate perspective, but from a, wow,
Yeah.
I'm nourishing you with movement because I love you and I'm looking forward to
Hmm.
creating life within this body. And also, like, I get to connect with and have sex with my husband whenever I want to, right?
Right.
Like, it's
Right.
a sexy, fun, flirty time if you allow it to be that.
Do you know what I thought about the other day? I
Tell
thought,
me.
if I was 60, 70, 80 years old and I
Yeah.
looked back on my early 30s and I was like, how did that experience look like between me and my husband, or even with myself, or whatever it might be? Just how did I feel during that time? Do you want to look back and be like, yeah, we fought every day because, he wouldn't have sex with me on my peak day, or
Yeah.
every cycle was a stressor because I was obsessively tracking my hormones and letting it stress me out. And I literally wasted all this time and like stress on my marriage. Like, Or do you want to look back and like what you just said, like make it a time where you can make it a positive of like, I got to have sex with my husband whenever I wanted to. Like I got to make it this fun thing. And I was like, oh my gosh, like
Yeah.
how many people are wasting like their youth and the best years of their marriage before kids on like stressing about stuff that's out of their control, you know?
Amen. Amen. My mom said this to me once, and it was, I was kind of like blindsided, but maybe it wasn't my mom. Someone said this to me, but I
Yeah.
want to attribute to her because it sounds like something that she would say. But we were talking about infertility, and we were talking about just like not knowing when it's going to happen and God's plan and all of these things. And she said, if you want to be fertile, then you have to act fertile.
Oh yeah,
You know,
absolutely.
and what does fertility look like from fertility is analogous to abundance in my mind, right?
Absolutely.
Like, and I'm not saying, oh, everyone can think their way out of infertility. I'm not saying that at all. But like,
Well, if you think of the
all
word
this,
fruitful, it's what it means. Yeah.
totally. And God's command to us when it comes to all of this is very clear. Be fruitful and multiply.
Yeah.
Right?
Yeah.
And what does that look like from a personality perspective? Does it look like someone who's micromanaging every single thing that their partner puts into their body? Does it look like someone who is, you know, having this like robotic sex life when their husband only when they're about to ovulate?
Correct.
Does it look like, or does it look like putting a little bit of ease around it all, understanding that the plan is bigger than what you can imagine.
Right.
And not only that, again, like this is a fun, sexy, flirtatious time.
Right. 100%. And I think that the women who do focus on that hyperfixation and focus on like and you're welcome to talk to my husband about this, but we notice a lot of our male patients start to have performance anxiety. And this is like why I'm giving this girl advice to people, because if you put this immense pressure on your husband to perform and you make it about timing and you make it about this and you make it about your, like, you got a positive LH strip. And so now you have to have sex within 15 minutes. Like, that's not even how it works, right? Like you have so much time after you have that peak that you can still conceive. And then you can also conceive 5 days prior to your peak day. I mean, sperm can live for 5 days in healthy cervical fluid. So when you're putting all this pressure on your husband, not to say they're like a victim, right? But it is creating an unnatural pressure. And some men really crack under that pressure.
Yeah.
And that's not a bad thing on them, but a lot of men want to please their wives and they want to make sure they get that baby and they want to complete their family or whatever it might be. And I think that can be really, really hard and hard on the marriage. And I've seen that quite a bit in my patients who really make it like almost like they gamify it and they make it like very, very numerically driven. And I think that can be a big hindrance to getting pregnant. Because then, I mean, I see in all these, are you in all these like Facebook groups or anything like that?
Oh,
like,
yeah.
Okay. The amount of times I want to just comment to people and be like, you need to like get off the internet.
No, literally go touch grass, remove, like literally throw your phone in the pond and leave it there. Like I completely agree with you. And I think that from a biblical perspective, it takes the spotlight off of your connection with your husband and puts it on the children before they even enter the universe.
100%.
And I think that imbalance of power dynamic and imbalance of who should be the priority, it is very it's stressful to a marriage.
Well, yeah. And then that's when you get the husband and wife who the kids are out of the house. They don't know each other. They don't like each other. They get divorced when the kids go to college because immediately their first thing was, oh, we got to get pregnant. And they weren't even ever prioritizing the marriage to begin with. It was like, we got pregnant, we bought the house, you know, all the things we checked the boxes, but like we never actually connected. And then we made our kids our entire lives. We never went on date nights. Like we never, like I know people who literally do not date their husband. They don't date their spouses anymore. And I'm like, that's not great.
Right.
So,
right.
Yeah.
And I think that also ties back to, as we're talking about like God's timing, I think there's a tendency, and I have seen this at different points in my life with myself, where when you're not getting the thing that you want at the exact moment that you want it, there's a tendency to sit idly and wait. There's a tendency to sit idly and not think that any motion that you make in your life is actually moving you closer to that goal, even if it doesn't seem like it's, you know, pushing you in that direction. What I mean by that is if it's not happening for you right away, how can
Mhm.
you make sure that the time that you do have that is left between you and your partner, just the two of you, which you will never get back, you are
Right.
using that in a way that makes your relationship more connective, more fruitful, and really diving into the things that only the two of you can have together as a couple?
Right. Yeah,
It's real.
100%. I'm telling you, girl, we're getting deep. It's like a real
I
thing.
know. It's a very real thing. Okay. While we're on a deep topic,
Yeah.
I know we talked about low progesterone, and I know we
Yep.
talked about how it seems like it's more common, but
Mhm.
something else, Natalie, that is
Mhm.
so much more common to me. And I
Mhm.
know that this is not just me. I think everyone is seeing this around them,
Mhm.
is recurrent miscarriage.
Yep.
And I have thoughts again on why this is
Mhm.
happening. I think it's probably not one thing. I think it's many
Mhm.
things,
Mhm.
but I'm curious why you think this is becoming so common and
Mhm.
what we can do in our preconception prep to decrease those chances of miscarriage, which I know falls on
Mhm.
both the man and the
Yeah.
woman, obviously.
Which it actually largely, in my opinion, much more largely falls on the man, to be honest. The quality
Wow.
and the
Yeah.
health of the husband and the sperm can really dictate the health of the placenta, the health of the baby, the health of the pregnancy. The DNA fragmentation of the male can absolutely be why people are having recurrent miscarriages. And I don't want to put all the blame on the men, but I feel like all the blame is almost always on the women. And so I want to highlight that, of course, too, in that is a really big part of it. And having just a normal semen analysis doesn't mean that there's not going to still be issues with that. That's one thing. So that's like one on my list, right? Like you have to evaluate the health of the male. You have to take that into consideration. And many couples, I feel like, don't get to the point where they start evaluating the health of the male until the recurrent miscarriages, right?
Mm-hmm.
So that is where I think husband and wife taking equal responsibility in the preconception journey is really crucial and critical. And this is what I talk about too in my program. And that's why we have a male fertility module. Jake teaches that. And so I think having the men equally as committed is crucial because
Mm.
you're literally taking 50% of the ingredients from the male and 50% from the female, and you're making a baby, right? And so you're taking half the DNA there and half the DNA there. So I think that's a really big piece of it. I know we talked about in our last episode, but I'll reiterate a little bit is the silent uterine infections. In my
Yes.
opinion, if you've had one miscarriage, I think it's important. One, if not two, I would immediately start looking for infections. I wouldn't wait till there's three, four, five. I wouldn't even wait, beyond one personally. I would want to be looking for infections in the environment that could be causing miscarriage, loss, implantation failure, whatever it might be. So that's a really common one I'm seeing in clinical practice, right? And then another one being obviously low progesterone,
Yeah.
which we've talked, a lot about today, but low progesterone or just progesterone insufficiency in general can cause early miscarriage. I mean, for a long time, it was like one of the only things that people talked about is low progesterone causing miscarriage. And still, I feel like a lot of providers only talk about that. I'm like, that's actually low on my totem pole, believe it or not. Like it's low on my list of differentials if someone's had a miscarriage. Now, granted, I monitor progesterone in all my patients, so I
Right.
know it's not that in 90% of them. However, if you are pregnant, you should absolutely advocate for your progesterone to be checked every 7 to 10 days, in my opinion. And that's what I do. As soon as we get
Why
a
is that
positive
not
pregnancy
standard
test,
of care? I know that like
I have
this
no
is one of the
idea.
things that I mean, I have seen it happen with my friends. It's happened with myself where you go to
Mm-hmm.
have your HCG tested and you're like, "Hey,
Mm-hmm.
can I get progesterone too?" Oh, it doesn't matter.
Mm-hmm. They just want to confirm that there's a pregnancy there. And I'm like, no, no, I want to confirm that there's a pregnancy there and that it's a healthy one. I don't want
Right.
to just know that, like, okay, because you could be having a chemical and HCG is high.
Mhm.
So I want to know there's a positive pregnancy. The body also is making enough progesterone to sustain this pregnancy.
Right.
Now, outcomes are not typically great if you start supplementing with progesterone and progesterone still won't climb. It's not a
Mm.
great sign. But either way, I think you should always try. And there's no harm in taking progesterone, right? Now, obviously, talk to your doctors, all the things. Like discuss that with whoever your provider is. But in my opinion, there is no harm in taking it. If it were me, I would take it. If I had concerns or if my progesterone was teetering on the line of healthy or normal, I'd probably still take it. So I think that's one whole picture that women need to know to advocate for because it is
Mm.
the easiest way to sustain a pregnancy. If you have a healthy pregnancy, healthy embryo, all the things, and your progesterone's just not quite there, supplementing, absolutely. I'm a huge fan of that.
And do you
Um,
start taking it from the moment you get a positive pregnancy test?
I would. I
Yeah.
would. Yeah, or what I do with my patients is positive pregnancy test, we go straight to the lab. I wait till the results are back, and then we decide together, hey, do they need to go and get some progesterone? Do they need to not? Some of my patients just make incredible amounts of progesterone. They don't need it. And so in those situations, I'm like, let's just like let it ride. Let's let your
Yeah.
pregnancy just like, let's let your body do its thing. But I'm not going to make someone like risk a miscarriage because, I just think that's
Of
silly.
course. Yeah, I
And
agree.
I love working with midwives for this reason. So like midwives are just wonderful. They're very proactive about that. I love and respect them for that reason. For the most part, they're really, really good about it. So I think that's one thing. Low choline is another thing that I've seen because it can cause poor egg quality, which then causes implantation failure, recurrent pregnancy loss, placental insufficiency, higher inflammation in the brain. The baby's brain and nervous system starts developing almost before some people even know that they're pregnant. Hence why
Wow.
you also should not wait until you are pregnant to start a prenatal. We've got to talk about that. But choline levels are really, really important. And choline is one of the most under-recognized, underutilized critical nutrients in preconception and pregnancy. Like by far, hill I will die on since day one of clinical practice. Like I've been
Yep.
obsessed with choline because you can do everything right with folate, with B12, all the things, and you could be missing a major piece of the puzzle with choline. So
It
go
is
ahead.
so overlooked. And I think a lot
Yeah.
of prenatals that I see and would absolutely never
Mhm.
myself take, but are very popular, have insufficient amounts of choline.
They all do.
Yeah,
Hmm.
exactly. You guys have what, 900 milligrams?
900 milligrams. It's double the
Yeah.
highest of any prenatal on the market,
And
which,
that's so important because
mhm.
I think I saw a study recently, and you keep me honest on this. I know you've read all the literature, but
Mhm.
I want to say it was women who take 800 or more milligrams of choline during
Yeah.
pregnancy, their children score higher on IQ tests.
Yes. So yep, um they compared women taking a dose of like 480 milligrams of choline to women taking 900 milligrams of choline, and they noticed their babies had better IQ scores, better neurological development, better outcomes as far as performance tests and things like that. All of like the developmental testing that they were doing, all of the outcomes were better in the group
Yeah.
of women with the higher choline intake. And there's several other studies like that too. But yes, I think I've even seen in my patient demographic, my patient population, like my patients that are having like the 2-year-olds, the 3-year-olds, the 4-year-olds, I've seen them now like taking my prenatal through their
Mm.
pregnancies because
Yep.
we launched our prenatal in 2021. The babies are brilliant. They have full heads of hair, like
Yeah.
thick heads of hair. And I have patients and friends that have been on our prenatal that their babies are like talking full sentences around a year old,
That
like
is
a
wild.
year to year and a half, like speaking more words than any of the kids their age, talking in full sentences. They're reading books younger. Their attention spans are longer. They're not ADD, they're not ADHD, they're not all over the place, they're not bouncing off the walls. They're more stable. They're more, you can tell they're more emotionally intelligent. It's just like it's wild, and I don't ever want to like mom shame like people or anything like that, but it's cool to see what
Yeah.
happens when and they're all like giving them grass-fed butter at like 6 months
Yes.
old and
Yes.
like all the
Yes.
things.
I
Of
love it.
course, their first food is like steak. You know,
Hmm.
it's a huge piece of the puzzle, but I have had women tell me like I'm comparing my two children that I've had on and off of this high dose of choline, and I can see a significant difference. Even with infertility cases really, really early on in practice, even before my prenatal was even a thing, um, I was literally just implementing high doses of choline for people, and
Mm.
it was literally reversing infertility.
That's so
So
wild.
so yeah, it's like, why not just kill two birds with one stone, get a great quality prenatal that already has what you need in it? Because choline is an expensive nutrient. And that's
Mm.
why we wanted to include it because my women before were having to take choline that was $60, a prenatal that was $50, all the things. And it just got really, really expensive. Obviously, you can also eat choline, right?
Yep.
You can eat tons of eggs and things like that. I noticed that a lot of women struggle to get in like you would need to eat like 6 to 7 eggs a day to get what you actually need. Most women can't. A lot of my guy
No.
friends eat that.
Yeah.
I eat 3 to 4 if I can, obviously, and I know I'm filling in the gaps where I need to with other stuff. But we simply just aren't getting it through our diet like we need to. But the goal
Hmm.
is always let's get as much as we can through the diet. Let's get as
Yeah,
much as we can through the food. 100%.
absolutely.
Um, Sorry. So back to other reasons for miscarriage. So we talked about that. We talked about male factor. We talked about choline. Um, we talked about progesterone, and infections. I would say one of the other things that I see with recurrent miscarriage, we talked about uterine infections. Also, vaginal environment is a really, really big one. So if we have an inflamed vaginal environment, that can be a huge piece of the puzzle because it also can be connected to the gut environment. So gut infections translocate to vaginal infections. Like H. pylori, for instance, we're seeing higher rates of miscarriage in patients with H. pylori. So, H. pylori infections in the gut can cause systemic inflammation, obviously not connected with the vaginal canal or vaginal inflammation. That's a side note, but it can cause inflammation systemically that can cause miscarriage. So, I think that's a really, really big one too, is you never want to, if you're having recurrent miscarriages, you never
Mhm.
want to neglect ruling out infections and also anemias. So, anemia being iron deficient anemic or anemic without an iron deficiency is very, very important as well. Because without iron, as an example, you're not getting enough oxygen through the placenta to the fetus and the bloodstream. And the body will
Wow.
perceive that as not having enough resources to sustain a healthy pregnancy.
Yeah. Have you seen the videos of like vegan placentas
Yes,
versus, yes, it's
I feel like we talked
crazy.
about that in our last episode.
Maybe. Yeah.
Um,
Insane.
It is. It's you can see a really nice, vibrant, healthy placenta versus a
Hmm.
vegan placenta, and the vegan placenta will almost be like gray and just
Yes.
like unhealthy. And then the animal-based placenta or just placenta of a meat eater will be super red and vibrant.
Yep.
Something that obviously is understudied at this point. I think we're going to find out more about it. And I can't remember if we talked about this, but with infertility and miscarriages, I think a big issue, and I might get some hate for this, is I think it has a lot to do with COVID and even like long haul COVID and microclots. I mean,
1000%. That's what I was alluding to when I said I have my thoughts. I mean, I think long
yes,
COVID and also the COVID
yeah,
vaccine.
100% the COVID vaccine and the COVID virus itself.
Hmm.
The vaccine, 100%. I have told so many people, I have never seen so many miscarriages in my life since this thing came out. Never in my,
Yep.
like my first several years of practice before like the whole population, I feel like was almost everyone was vaccinated. I never saw miscarriages like I see now.
Yeah. It's
I never
crazy.
saw infertility like I see now.
Yep.
And I would be stupid to not take that into consideration as a provider. Like, and just be objective and be like, okay, what has changed? What has changed in the last 5 years? What in the climate of our world? What has changed? Um, and
Yeah.
I think there's no denying it.
There isn't. And COVID was such a vascular disease. I was actually in
Yes.
the elevator with my mom the other day, and one of her neighbors in the building that she lives in Florida got in, and he is a medical device salesman, and he
Mm-hmm.
sells heart like
Yeah.
valves and
Yep.
pacemakers and
Like
all this
stents
stuff.
and stuff.
Yeah, exactly. And my mom goes, she goes, how's business? And he goes, booming. And she goes, bet your clientele is a lot younger than it used to be, huh? And he
Yep.
goes, you have no idea. And she
Mm-hmm.
goes, that COVID vaccine is the greatest crime against humanity that has ever happened. And the guy goes,
100%.
it's the greatest crime against young people because
Yep.
my patients used to be 60, 70, 80
Yep.
years old. Now I am giving pacemakers to
Yep.
people who are 20 and 30 years old.
Yeah.
And that's not meant to scare anyone. I think
Mm-hmm.
we have to be realistic about what the implications of these things are. And
Mm-hmm.
I agree with you. I mean, it might be anecdotal, but
Yeah.
I personally know people who have had 5, 6 miscarriages
Yeah.
since having the COVID vaccine. And that's really scary and something that,
Yeah.
I mean, I at least never saw before that.
Yeah, 100%. And it's really wonderful to see there are a lot of medical doctors now at this point who are
Yeah.
coming around and who are now like turning their whole practices into treating people with long haul or people that are COVID vaccine injured and things like that, because they're like, okay, we can't deny it. Like these people
Right.
are sick, these people are injured. Someone has to help them, right?
Yep.
And there are things that you can do. So I hope to give, like, if you did get the vaccine or whatever it might be, I hope to give people some hope too with that. Like there are things that you can do. I love ozone IVs for that. I love systemic enzymes for that. You can do a lot
Mm-hmm.
to mitigate the after effects of it. It's not easy. It's not cheap, which is really unfortunate. I think it's somewhat fixable. I don't
Yeah.
know that I can say confidently it's 100% fixable for people, but who knows? I don't know.
Right.
I,
I
I think
agree.
we'll know
And
soon.
yeah, I think we will too. I think there's one thing that I recommend to a lot of people, and I will be curious on your thoughts on this. If you haven't seen
Hmm.
it, I'll send it to you. But Dr. McCullough has a
Hmm.
protocol that he puts people through that
Yeah.
like it's inclusive of supplements and then like you said,
Hmm.
ozone IVs and a few other
Yeah.
things. And there's a lot of literature online about how wonderful that's been for people who are
Yeah.
worried about the fact that they
Yeah.
did take it and maybe want to do what they can to rid their body of spike protein.
100%. That's great advice. I love that. And I 100% recommend people look into that if they suspect or if they've gotten it, especially if they're dealing with infertility,
Yeah.
especially if they're dealing with infertility. Yeah.
Yeah, absolutely. I want to talk. I mean, we're gonna have to do this one quick, and it's not a quick topic,
Yeah.
but I know you can do it. Um, we need to talk a little bit about MTHFR because I texted you
Yes.
about this
Okay.
probably three
Yes.
weeks ago,
Yes.
and then I'm curious about your thoughts on this. Obviously, coming
Yep.
off the vaccine topic, I think MTHFR really
Yeah.
weaves into vaccines quite a bit. But
Hmm.
what do you think about MTHFR in terms of pregnancy, how we prepare for
Hmm.
pregnancy, and specifically about prenatals?
Yep. I mean, I think the biggest thing, number one, if you have MTHFR or suspect it, is you never consume a product with folic acid. No fortified breads or foods with folic acid, which we shouldn't be eating either way. And
Gavin
absolutely,
Newsom, listen now because of the tortilla. Did you see that?
yes, yeah, the tortilla thing,
Talking
which
about crimes against humanity. That's crazy.
which our food has been fortified with folic acid for decades, and people aren't
Yeah.
even like paying attention. Which I do think it's crazy though that he's mandating that. Like that's insane.
Yeah.
Um, but absolutely, I mean, for anybody, under no circumstance would I ever recommend folic acid for anybody at this point. Like it is just not beneficial to most people. And knowing that about 50% of the population has the MTHFR variant and they cannot convert folic acid to its methylated active form and usable form,
Hmm.
for that reason alone, I wouldn't recommend it. So you want to look for a prenatal or a multivitamin or whatever you're taking with methylated folate or even folinic acid is not bad. Ben Lynch talks a lot about folinic acid. That can be beneficial for some people. Um, but MTHFR, I feel like has in like recent years been a little overhyped more than it needs to be, only because I think we can absolutely control our environment. If
Yeah.
we have MTHFR, can we necessarily control whether or not we have it? No. Can we control how our genes are reflected through our environment and our lifestyle? Sure, absolutely. So the biggest thing is not exposing yourself to things like folic acid, not exposing yourself to fortified foods. Ben Lynch talks about not eating like smoked and processed meats and things like that
Mm.
if you have MTHFR, not like using your smoker all the time. He has a clean genes protocol he talks about for that. So just like being aware, like dried fruits, aged cheeses, things like that can be more can cause more reactions for people with MTHFR. When it comes to fertility, I feel like people, if they're dealing with fertility, they get an MTHFR test done, they get a positive MTHFR result, they find out they have a variant, is what's what it's called, or a SNP, and they're like, oh, this is immediately why I have infertility. And
Right.
it's like, no, a combination of MTHFR plus inflammation plus environmental stress plus all the toxins that you're surrounding yourself with, plus maybe hyperprocessed foods, that might be the reason why you're having infertility. Or let's say
Mm.
you have MTHFR and then you got the COVID vaccine, and then you also eat a hyperprocessed diet and you don't sleep well, and you don't get sun. That combination is where it causes a problem because you're already a little bit more sensitive than the population without the MTHFR variant. So I don't like the hyperfixation on I have or I don't have MTHFR,
Yeah.
because you can have methylation issues and not have miscarriages and inflammation and things like that. And we can also support it, right? So by focusing on methylated foods and or methylated B vitamins and quality foods and things like that too.
Mm.
So Yeah. So the variant itself to me is not a huge issue. Plus, I think I told you, I'm like, I have all my patients live as if they have MTHFR either way.
Right. Which we
So
all should be, right? Like avoiding
absolutely.
ultra processed foods,
Yeah.
taking high quality methylated supplements,
Yeah.
eating, an animal based diet that's high
Yeah.
in nutritive protein, et cetera. So yeah, I mean,
Yeah.
I think better to assume that you have it and just live in that way.
100%. And if you're worried, get homocysteine checked. It's a blood marker. Get your
Mm-hmm.
homocysteine checked. If that's high, address that. Work with a provider who understands it. But don't hyperfixate on one thing, right? Because I've done extensive genetic tests on myself, and there's nothing that I have majorly changed based on that extensive testing, other than I'm a little bit more cautious. I use a lot of magnesium because I know I have the COMT variant, which is magnesium dependent. Most women do, especially most women with PCOS. They have MTHFR, they have COMT. It's very common. That's why I included so much magnesium in my prenatal, things like that. So you can just be more aware, but you don't
Yeah,
need to like stress or fixate.
that makes sense.
Mm-hmm.
Another big subject that is quite controversial, but I think we would be
Yeah.
remiss not to talk about it is GLP-1s
Okay.
and sort of
Yeah.
I mean, this is nuanced, right? Because I think
So
for some
nuanced.
women, it can actually be really helpful when it comes
Mm-hmm.
to fertility and getting them
Yeah.
into a more pro-fertile place. And then
Yeah.
for other women, I think they're totally being abused. So I'm curious what your thoughts
Yeah.
are.
I think the dose really matters. I think the dose is the biggest thing that matters, which I think that really applies to like any pharmaceutical.
Yeah. Yeah.
You can you can completely destroy your body with the wrong dose of anything, right?
Mm.
Um, I have seen in some women that it harms their fertility because they don't eat enough on it. They starve
Yep.
themselves. They're not nourishing when they're on it. That is problematic, in my opinion. What is also problematic is if you are walking around with crazy high amounts of inflammation and insulin resistance that you're not addressing, which we can do that with diet and lifestyle all day long. I've done it for a decade or more without GLPs ever being a thing. But if you have tried everything else and you cannot get your A1C or your insulin or your blood sugar markers to budge and you need support in that area, I am not crazy against like micro dosing certain ones. And there's
Mm.
promising studies coming about like retatrutide and tirzepatide and things like that that I think are I would never ever in my life use Ozempic or like any sort of like
Wegovy.
conventional,
Yeah.
yeah, never in my life ever. Like you couldn't pin me down to use that. Absolutely not. And I probably wouldn't recommend it. But once again, it's a case by case basis. In regards to fertility, my only concern is that what I've seen in the GLPs is in my opinion, they stunt follicular growth a little bit. And I've seen it harm estrogen levels as far as like women on GLPs, their estrogen levels just don't get as vibrant as they were before.
Interesting.
And I've seen it stall ovulation and things like that too, and make cycles a little wonky. I've also seen the opposite. So if someone has really uncontrolled insulin resistance when they get on it, it might help normalize their cycles. And I've heard those stories too. So I don't want to like discount those women either. But I think it's a nuanced topic. I think people are so willy-nilly getting on them. Like,
Yeah.
the same people that question all these other things are like, yeah, I'm just going to go ahead and get on Ozempic. And it's like, okay.
Yeah.
Did you see also that conventional, or I should say like big food manufacturers are putting GLP resistant ingredients in the food system? So like your body is resistant to a GLP-1 when
Oh
you
my
eat that food.
God.
So
Of
like
course they are.
so like you eat the food, you gain weight, and a GLP like doesn't even help.
See, and that is the corporate capture that we should all be thinking about of like, oh wow, we really don't hate them enough. Like I know that
Yes.
sounds so hateful, but it's like
Yes.
that is disgusting. I also think
Yes.
though the part of this GLP-1 conversation that I think is so important is like
Mm-hmm.
yes, if you fall into that uber insulin resistant camp, you
Mm-hmm.
maybe have PCOS, you're not
Right.
having consistent cycles, your blood sugar's all over the place. If microdosing tirzepatide or Retta is what you decide to
Mm-hmm.
do, that
Mm-hmm.
has to coincide with significant lifestyle changes.
100%.
Like it is the
100%.
cherry on top, not at
Yeah.
all the sundae below it, you
Yeah,
know?
it's like painting over a wall with mold. Like if you're
Right.
not going to rip out that wall and put on
Amen.
some new drywall and like actually bring the house down to the studs, like painting over mold, you're
Yeah.
just like putting lipstick on a pig at that point. Like you're not solving any sort of a problem. And that's why a lot of people on the GLPs, they get off and they gain all the weight back because they never learned the lifestyle modifications and they're now
Mhm.
lifelong dependent on them. And a lot of people low key are just using food to cope with emotional stressors. And if
Yeah.
you are using a GLP to just suppress your hunger hormones so that you don't overeat, I mean, that's like you're also putting a band-aid on a bigger issue too.
Hmm.
So it's like we need to get to the root of this. But if you truly have like deep-rooted metabolic dysfunction that is just so resistant to everything else, then I think that might be a time and a place to talk to a provider that really understands microdosing and things like that to get some guidance there. And I have had a few patients where I've suggested that, where I'm like, you've done everything else. You've done the things, and or maybe they don't want to do the things. And I'm like, here's your other option, right?
Right.
Like if you don't want to walk 5,000 steps a day at minimum,
Hmm.
like here are your two options, right?
Yes, exactly.
So yeah, that's I don't like those conversations, but sometimes I have to have them.
Yeah, which makes sense. Okay, one more. And I'm saying this,
Yes.
I'm actually asking this for myself because I have my nails gel painted. Don't come for me. But I want
Yeah.
to talk about like Botox, fillers,
Yeah.
nails, hair
Yeah.
dye, all this
Yeah.
stuff that like it's fun, it's pretty,
Yeah. Yeah.
Like how do we think about these things in terms of
Yeah.
are they harming our fertility? I fear the answer is yes.
Yeah.
And what are the alternatives that are Natalie approved?
Okay. So I get my nails done too.
Yeah.
My compromise, I always say this fits in my 10%, or maybe I should say my 5%. I probably live 95/5. Fits in my 5%. My compromise is I do not go to a conventional nail salon. I go to
Mm,
a private salon suite where there's just one room. My nail tech does not use any powders that are airborne at all.
yep.
She uses
Yep.
we've talked extensively about this actually. She gets all of her products from Europe. She
Mm,
uses only liquid or gel products. So there's
mm,
no powder getting into there that I'm inhaling. She has incredible ventilation. I only get them done once a month.
mm-hmm.
So I'm not sitting in a nail salon twice a month for like 2 hours at a time, breathing in these fumes, right? So that's my like happy medium of that.
Yeah.
If it ever comes out that like these European products that she has are no longer safe, I've even told her, I'm like, she's doing the research on it too for me. She's like,
Yeah.
these are the specific chemicals you need to worry about. I'm not using anything with them in there. I'm like, wonderful. Botox is a no-go for me. I've
Mm,
talked extensively with some of my friends that are in the aesthetic world that are also holistic, and they're like, we don't do it anymore. Like
yeah.
we just can't like wrap our heads around like it's not safe. It's a neurotoxin and it can go systemic. And I have heard stories of women saying, as soon as I stopped getting Botox is when I got pregnant. And I
Wow.
do worry that it is harming fertility. And it's something that they're not going to study that. Do you
Right.
think that the pharmaceutical companies that are making Botox are going to do a study showing that it causes infertility? They're going to eliminate half of their patient population. Like
Absolutely.
people
And
are
you
going to
can't
stop
get
using it.
Botox. You can't get Botox while you're pregnant, nor can you get it while you're breastfeeding. So why
Right.
would you ever think that that's something that you can do leading up to conception?
Do you know what I've heard women say and do?
Tell
Is
me.
they get mega doses of Botox before they get pregnant to keep their face frozen during the whole pregnancy. And I'm like, you do
Eee.
realize that everything you put in your body 9 to 12 months before pregnancy is going to be directly passed to your baby. Pregnancy, your first baby almost acts like a sponge for toxins.
Yeah.
Like they have found hundreds of chemicals in the umbilical cord blood of thousands of samples. And so whatever you put into your body or expose your body to in the 9 to 12 months leading up to conception is directly going to be given to your baby. So
Yeah.
do you want to expose yourself to toxic chemicals that are going to be passed to your baby? So if I was like a nail biter and I like chewed my nails, I would
Right.
absolutely not get my nails done, right?
Hmm.
Hair dye, there are organic hair companies now that are making cleaner products if you want to get them done. My whole thing is I try not to put anything on my scalp. So like
Right.
if you
Do
are a blonde,
balayage
do a
or yeah.
balayage. Like there are ways around it. Once again, like take your binders, take some NAC before you go get your hair or nails done, take some binders afterwards, sit in the sauna afterwards. I do a magnesium bath every time I have to go into a salon or a public place like that. I do
Hmm.
bentonite clay, magnesium flakes. I put some drops of grapefruit in my bath or like zendocrine, like a detox blend. And I like sweat it out. And that's after just like
Yeah.
getting hair or nails done. So I think there are ways around it, but like the Botox, the fillers, the injectables, that where it has the ability to go to the bloodstream, and I know it's supposed to be in the muscle or above the muscle or whatever it might be, but if it has the ability to go to the bloodstream, that's a concern for me.
Yeah, I think that's totally fair. And I think a lot of it comes down to like hedging, like deciding the 5%, like you said, that you're
Yeah.
like, this is going to be my thing. And then
Mm-hmm.
you really do want to try
Yeah.
to be as close to perfect as you can on the other stuff to give yourself that
Yeah.
room.
And like, I am not gonna lie, I love skincare. I love microneedling. I
Me
love
too.
gentle lasers. I love all that. Like anything that is not putting a chemical or a toxin on my skin. I'm all about preventative stuff. I love skincare.
Yeah.
Love skincare. And so if you are worried about like aging naturally and gracefully and all the things, and you want to like do these like gentle things, opt for something like microneedling, opt for things that are not injecting neurotoxin into your body. And I think in another 15 to 20 years, we're going to have a whole new body of research coming out about this. And if it's better, maybe I'll change my mind about it. Maybe it'll change my mind in the next 5 to 10. But for now, the toxins, I just can't wrap my head around, especially for fertility, but for health in general,
Yeah.
especially when women are more prone to like Alzheimer's and dementia and things like that. I've heard several people speculate that they think Botox is going to be connected to higher rates of dementia in women and things like that.
Oof. Yeah, that's
Yeah.
scary. Okay, I have to tell you one thing that I wanted to say earlier and I completely forgot.
Yes.
You recommended NAC to me on our last podcast for
Yes.
cervical mucus because I feel like a
Yes.
lot of women feel like they're not producing sufficient cervical mucus or they just
Absolutely.
don't know how to check for cervical mucus.
Yes.
But when I tell you taking NAC has changed that for me, it's crazy because
Yay.
I never realized that
Yeah.
it's like it's very mucolytic the same way that people are taking
Yep.
Mucinex.
Yep.
I wouldn't touch Mucinex with a 10-foot pole, but NAC,
Same.
I'm all for it.
Same. That's why we have that in every single fertility bundle I've ever created. I have had NAC in that in our supplement line because NAC improves pregnancy outcomes. It improves cervical fluid. It improves insulin resistance. It supports the immune system. Like if I could go to a deserted island with like anything or like maybe like three things, NAC would probably be one of them because like it acts as a binder if it needs to be a binder.
Yep.
There's so many cool things that NAC can do. And I'm so excited because I've heard all my patients say that too.
Yeah, it's
Um,
crazy.
it's amazing. It is amazing.
Okay, Natalie, last question. I know I've said that like 4 times now, but if you could pick just 3 things that every woman or every couple should do leading up to pregnancy, let's say in the 6 months ahead of pregnancy, what would your 3 things be?
My 3 things. Okay, it would be move your body as religiously as you possibly can, both of you. Both of you. Movement and then a movement outside. So to tie in that, getting sunlight as consistently as you possibly can and going to sleep with the sun or going down with the sun, waking up with the sun. And then eating the cleanest you ever have in your life.
Yeah.
I think that's the biggest thing. And then ideally you just adapt that lifestyle and you do it forever. That's the goal. The goal is not to stop when you get pregnant. Like, please do not stop when you get pregnant because every choice that you make, your child watches. Every choice that you make starting from preconception and beyond impacts the outcome of your child.
But also take a good prenatal.
Of course. Yeah. I mean,
I'm like, you're missing the big one.
No, I did forget the big one. No, I would say 3 things is hard, but I would never say like prenatal over diet and lifestyle. But yes, please choose a quality prenatal. It's one of the most important decisions that you're going to make in preconception and pregnancy, 100% across the board. The same as like every choice you make at the grocery store. It's the most important choice. And please do not just like buy something because an influencer says so. Like the fashion bloggers, and then they puke their whole pregnancy and they feel terrible their whole pregnancy. I'm like, why are we taking advice from people who literally don't know anything about health and they have awful pregnancies? Like, I'm sorry.
100%. No,
call it out.
Mic drop, you're 100% correct.
Yes. Stop taking advice from fashion bloggers that have horrible pregnancies. That's what I'll say.
I love it. Okay, Natalie, tell people where they can find you on Instagram. Tell them where they can shop Fig.
Yes. Okay. So on Instagram, I'm Dr. Natalie Underberg. And then my supplement company is called Fig Wellness. We are a faith-based preconception wellness company. You can find us at figwellness.co, both online and on Instagram. we have prenatal supplements for both men and women, which you'll hear on my husband's episode, which will be
Yeah.
so fun. I'm excited
I'm
to
so
hear
excited.
that.
I know, I'm so excited.
Because yeah, we've put a lot of heart and intention into the creation of everything we've done, and have the clinical experience to to back it, which is fun.
Yeah.
So yeah, that's where you can find me. And if you have any questions about what we do or supplements, feel free to DM us. And I respond to every single DM that I get personally. No one runs my Instagram but me. So
I love
if
it.
you have it, and we are accepting new patients in our practice too. We've opened some spots.
Okay, perfect. I will put all of that in the show notes.
Yeah.
Thank you so much for coming on and doing this. This is going to help so many women. You are
love it.
truly one of my favorite people, and I'm just so glad that we got the chance to connect. And I'm talking to your husband next.
Yay. Okay, well, I'm excited.
Thank you guys so much for listening. It really does mean the world to us. If you like the episode, please share it with a friend, rate, review, subscribe to the show. Follow Natalie. She truly is such a wealth of knowledge, and she will respond if you DM like she said. But that's it for this week. Tune in next week for my episode with her husband. We are talking all things male fertility. I cannot wait. I will see you guys next week, and enjoy the rest of your day.